Today I want to talk to you about the connection between hip issues and back pain. And this is in response to a comment that I received on one of my other YouTube videos, this one, about someone who had had their hips replaced and several years later developed back pain and can't seem to solve it. And this video is kind of explaining how that can be. Now, it's important to understand that if you go to most doctors, physical therapists, or chiropractors with a complaint of back pain, they will take x-rays and MRIs of your spine, and their treatment will focus on the back. And that's fine. But if that's not solving your pain, it's because that's not where the problem is. Your back or sciatic issues are simply responding to other forces elsewhere in your body. And so this video is going to be me attempting to explain how that works. Okay, here we go. Before we get started, I'm going to ask you to please subscribe, like, and most importantly, share this video with others who might be suffering from back or sciatic pain and might be a little frustrated with their lack of progress. This information can really help them. Thank you. Okay, so it's important to look at the body's architecture to understand how we're put together that could possibly explain how hip issues might create back issues. So in between the hip joint and the lumbar spine is this big thing called the pelvis. Look at how big these bones are, all right? There's two big bones and then they join with the sacrum, forming the pelvis. And then the lumbar spine articulates with that sacrum to form that L5-S1 area where most people have chronic breakdown of tissues, disc herniations, disc bulge, stenosis, things like that, spondylolisthesis. The reason is because the pelvis is large and it moves as a unit. And so anytime you have something big that's articulating with something smaller that articulates a lot, you're going to have a breakdown where that junction is. It's just simple mechanics. For instance, if I was holding a coat hanger, right, and then with the other hand is bending that coat hanger up and down, where's that coat hanger going to break? It's not going to break along this whole part, and it's not going to break in the fist part that's holding the coat hanger. It's going to break where the junction of the fist and the movement is occurring most. This is exactly how it works with the pelvis and spine. So where that pelvis is meeting that coat hanger of our spine, that's where you're going to get the most breakdown for that reason, because it's the part that's moving the most, reacting to this immovable portion of the body. And it's not so much that the pelvis doesn't move at all. Of course it moves, but relative to the spine articulations, it moves very little. And so the spine moving a lot creates this breakdown, this chronic tissue breakdown at this juncture. This is why most MRIs and X-ray results will always show L5-S1 breakdown more so than L4, L5, L3, L4, L2, L3, all of those higher levels, because those guys aren't absorbing, they're not butted up against this immovable object here, relatively. Hopefully that explains that. All right, so let's go further into what's going on here. So now that you get that the pelvis is a big thing that's relatively immovable compared to all of these smaller articulations in the spine, hopefully this makes sense that, oh yeah, that does make sense that this should break down then. And if you get that, then you're going to get the rest of this video. So what is causing the pelvis to move awkwardly or differently or wrong or be positioned wrong? Well, the pelvis isn't working on its own. The things that are affecting the pelvic orientation are the legs. Look at these long lever arms. They have massive, strong muscles that attach from the legs into the pelvis and hip joints. And so if something is wrong in the legs, that problem is going to be transferred to the pelvis, which then creates a problem at the pelvis. Well, you're not going to feel a lot of pelvic pain, because look how big these bones are. What you're going to do is you're going to feel the pain at the lumbar spine, because that's where this big thing meets this articulating thing that we just described. So any types of problems in the lower body will then be transferred to the pelvis, and then the spine has to respond to that. Well, what are some of these things that can happen? Well, the pelvis can be, if your thigh muscles are too tight, it can pull the pelvis forward too much. If that pelvis is pulled forward too much, I'll get this closer to the camera here. If the pelvis is pulled forward too much, it creates excessive arching at the lumbar spine here. Well, that arching creates compression and breakdown of those tissues. The spine doesn't really like that. And you can confirm this if you lie down on the ground and then bend your knees. Most people with back or sciatic pain will say, oh my gosh, my back feels so much better when my knees are bent versus when my legs are straight. Well, this is exactly what this is telling you, is that your pelvis is oriented forward too much, which is causing excessive arching, which then creates abnormal forces in the discs, those nerve roots, etc. So that's one of the orientations of the pelvis. Now, this also includes that you can have asymmetrical pulling of that pelvis forward. If one thigh is tighter than the other, if you have some problem in one leg rather than the other, it'll pull one side of the pelvis forward more than the other. Well, if we pull one side more than the other, it's going to create a rotated pelvis. And so you have an asymmetrical spinal response, which creates unilateral back pain, sciatic pain, SI joint pain, and so forth. Because you're creating torque through the pelvis and SI joint, and either the SI joint is going to become irritated, and frankly, some of the nerve roots that are feeding the sciatic nerve come from the sacrum, so that's going to become irritated. Or if it's irritating these nerve roots above the sacrum, it's going to irritate the lumbar spine area too. It can be both. So this is one of the reasons is asymmetrical forces acting on that pelvis cause unilateral back or sciatic or SI joint pain that no one seems to be able to figure out for you. And this is why, it's because they're only looking here instead of the forces that are acting on the pelvis causing this to respond. So that's one way that the pelvis can be oriented. Now, another very common way is that if you have an older problem in one leg, usually the brain will get around that by hiking one side of the pelvis higher than the other. The muscles that hike that pelvis up also attach to the rib cage. So they'll pull the rib cage down, creating what I call a side bending problem, and therefore increase compression of these vertebrae here. Well, of course, you now know that this is where the spinal or the sciatic nerve roots are. And so if this side is compressed, it's going to irritate those nerve roots of the sciatic nerve and therefore create radicular symptoms down the leg, into the foot, wherever. So it's this negative feedback loop. You have a problem here that creates this pattern that then causes compression of the sciatic nerve roots that then causes sciatic pain down your leg. Well, I bet all your doctors or medical practitioners have been saying, oh, you've got sciatic pain? It's got to be coming from your back. Well, now you can see that that's only half of the truth. The other half of the truth is, why is the back having problems in the first place? Because it's responding to the pelvis and therefore the forces that are acting on the pelvis from the legs. Because the legs are these big long lever arms acting on the pelvis. Now, I've made several videos that illustrate this in different ways. Here's one here about sciatic pain. Here's another one here for posture and back pain. Here's another one that helps you test your thigh bone structure to see how that might be influencing how you're walking and therefore your pelvic and lumbar dynamics. If you look at all of my videos and step back from them for just a moment, you'll see that anytime I talk about chronic back pain or sciatica or SI joint pain, I keep talking about the legs. Because if you have chronic problems, this is what most practitioners are missing. Because we're trained to focus only on the site of pain, not understand these big connections from the foot all the way up to the spine. We're not trained to understand that, as strange as it sounds. And I can go on about that. I've written a book called Solving the Pain Puzzle here. It explains how I figured all this out and my journey to understanding this and how this all links together. So I hope this answers how something at the hip joint can then affect the pelvis, which then can cause back or sciatic issues by irritating the nerve roots that then feed back down the leg. Just as much as it can happen from the hip joint, it can also happen from the knee, it can happen from the foot, it can happen from anywhere in the lower body system, any older injury. So you might say, well, I don't have any pain in my lower body system. You're right, because your brain has figured a way to get around all of that because you haven't been solving it correctly. And so it says, well, you got this old ankle issue, so I'm just going to do this so we don't keep running into this old ankle issue. Well, the brain's way of getting off of that is creating these types of compensation patterns. And so eventually, these old injuries catch up to you because your body can only compensate for so long before you really have to stop and pay attention to what's going on with your body. That's when we develop chronic back, sciatic, SI joint, or other issues. Any kind of chronic issue means that you haven't been looking in the right place because our body heals on its own very rapidly. I mean, let's think about this. If you cut your finger, that'll heal in a few days. If you sprain or strain a muscle or tear a muscle, that'll heal in 6 to 8 weeks. If you break a bone, that heals in 6 to 8 weeks. So as long as your body can heal like this, it should be able to mend all of these problems. But it won't be able to mend those problems if you haven't removed the hammers that are causing those problems in the first place. Where are those hammers? In your lower body system when it comes to the back, sciatic, or SI joint problems, for all of these reasons that I've outlined in this video. I hope this makes sense for you. All of my YouTube videos say the same thing in different ways. I would encourage you to watch. Here's one for sciatic pain. Here's one for back pain. Here's one to measure your thigh bone shape. All of these things matter. And if you don't want to go through and watch all my YouTube videos, just get my home programs because they will solve all the lower body system problems that typically cause any types of problems in your back, SI joint, sciatic issues, hip, knee, foot, neck, headaches, shoulder. It doesn't matter. I've figured it all out and they're all in my home programs. So anyway, I hope this helps you understand how hip or knee or foot issues can create and likely is creating your chronic back, sciatic, or SI joint issues that no one seems to be able to solve.